Thank you, Waziri Mosheru. Today, again, we are very privileged to be here for our 99th briefing, and on a day where we are here to support our healthcare workers and partnering, as the Waziri has said, together, celebrating the handshake between different cadres in health, but also partnerships with different institutions and organizations. And so for that, we are grateful and we are happy to be here. And as mentioned, again today, I had a very long, elaborate speech that really tries to highlight our engagement and our use of ICT within the Ministry of Health. And what I'll do before I get into the numbers, which I'm sure is something that you're waiting for, is perhaps to just emphasize that really ICT and technology plays a key role in moving the health sector forward and is actually fundamental to the attainment of the universal health coverage agenda. As you can see today, we are here working on, with our healthcare workers, a key building block when it comes to health systems, ensuring that we are taking care of them, that they are protected, and that they are contributing well in terms of this coronavirus pandemic. And so we do appreciate and recognize the sacrifice that nurses have made in the country as they continue to fight this virus, and not just nurses, as we say today, but all healthcare workers. I am informed that this call center really will be able to come in handy in terms of meeting the needs of all the healthcare workers. And today, as highlighted by Waziri Mosheru, there was a healthcare worker there, Susan, who really has told us of the importance of this center, the way that this center provides comfort. This center actually encourages healthcare workers to be able to speak out and to share their experiences and whatever difficulties they may be having in the field. And as she was taking us through this, she mentioned an important component of referral systems. Again, a sector or a specialty in health that can really benefit from ICT. The idea that this call center has actually mapped out all the different mental health practitioners in the country. And therefore, the referral system is that much better. As Susan attends to our healthcare workers, she's able to redirect them to their nearest center, and we're able to harness ICT in that space. Coming back to COVID, as we started our coronavirus response early on in the year in March, it's important to note again the Emergency Operations Center, again, that is housed by the landlord here and not charged, it's right there on that end of Kenyatta, was actually really utilizing ICT services. When you do visit that center, and perhaps the next briefing should be near there, you'll note and appreciate that the Emergency Operations Center really is data-driven. And in that center, through the collaboration of different partners, including WHO, Palladium Group, the Ministry of Health, they were able to design a COVID-19 digital solution. And here is where it gets tricky. So they call it the Kenya EMR web-based system. And I'm sure it has one of those APIs, Waziri Mosheru, that is able to really be able to assist us when it comes to contact tracing, testing, ensuring that we are actually able to follow up that one Kenyan who has tested positive and ensure that that contact data is available and that we even have visibility of subsequent results. And that is why through our COVID updates, we've been able to itemize for you what is happening in Kamkunji, what is happening in Westlands. All those data, all those figures that you see us highlighting day after day are really through the workings of data and ICT innovations at the Emergency Operations Center. Moving forward, last week, and I think earlier this week, we were able to explain to you that we are adopting a community-based approach when it comes to the coronavirus pandemic. And again, interestingly, ICT is actually playing a role in this approach. Through ICT, we've been able to train 60,000 community health volunteers. And again, this was done through just a mobile phone. And what is even more interesting is that this was not necessarily a smart mobile phone, but one that employed, I think you call it USSD technology or mobile-based technology. So something that is, less sophisticated compared to a smartphone. And these community health volunteers now are helping us in our home-based care program. Using that application, they're able to work as monitors and evaluators of our home-based care program. Again, a good contribution from ICT. And moving forward, even as we move on to the UHC agenda and ensure that we meet the President's objective in terms of ensuring that every Kenyan has financial protection, ICT will play a key role, ensuring that each and every one of you is enrolled in NHIF, ensuring that each and every one of you is able to access the healthcare services that they need, that we're able to identify you, that we're able to reduce fraud, we're able to be more accountable, all through ICT. Now to the numbers. Today, we had 3,918 samples that were tested. 178 people tested positive for coronavirus. This brings to total our country caseload to 5,384 so far. And cumulatively, we have tested 314,000. All the positive cases, except 3, are foreigners. We have 123 males and 55 females. And our youngest today is a 1-year-old infant, and the oldest is 76. Nairobi is leading today with 100 cases, followed by Kajiado with 21. We have Migori having 17, Kiambu 16, Busia 8, Mombasa 7, Machakos 4, Nakuru 2, Uasin Gishu, Kericho, and Taita Taveta each have 1 case. It's important to note and to appreciate that today we've discharged 34 patients. This brings the total number of recoveries to 1,857. We have also lost 2 patients today, sadly, and therefore our tally in terms of fatalities comes to 132. And our heartfelt condolences are extended to families and friends who've lost loved ones. Today, we will not be able to go through the disaggregation, but we have that data provided for you. As promised also, we've been able to provide for you a table that looks at the different positivity rates per county in terms of the samples that we've collected. And as I conclude, I'd like to express my sincere gratitude to all members who are present here today, taking recognition of all the healthcare workers who are here today. Let me assure you, really, from the beginning of the coronavirus response, all these faces that you see here were not sleeping. Perhaps they might be the first customers of this call center today. I'm sure they could share lots and lots of stories with you in terms of the hardships faced and, the mental health issues that come with dealing with such a pandemic. However, we are stronger today. Again, through that collaboration, we've been able to set this up. And remember, we also have a similar service that is available for you Kenyans, 719, again, a call center that is in this same complex. Utilize this facility. Mental health is not an issue to be ashamed of. We all are able to, be afflicted from this or have suffered at one point or another in our lives. And so let's come together, assist each other, and try and, move the country forward.